I would say about 4 years ago, when the idea of putting health data out there really started, the default setting, especially within the Department of Health and Human Services, was really closed when it came to data release and data liberation. Over the last 4 years, though, we've moved the needle quite a ways, and I think safely say that the culture has now changed to a default setting of open versus closed. People ask us all the time about how they can get data sets cataloged on healthdata.gov, which is our flagship site for cataloging all of the health data assets that we can find. And there's very little reluctance now to actually putting data out there. What's happening really is that people are starting to see the value of that data when developers or entrepreneurs or established companies or academics or researchers take that information and use it in ways that they never could have imagined. So I've heard a lot about Nashville and healthcare and health IT over the last couple of years, and this is actually the first time I've been to Nashville in this role. What's pretty amazing to me is that I think every story I heard coming up to yesterday when I arrived in town is pretty much true. It's a really robust ecosystem, and I learned actually yesterday that it's the largest industry in town by a long shot. So I think that there's a ton of opportunity here. And because I actually do believe that this idea of health technology is going to be one of the key catalysts and key drivers to actually accelerating the pace of change in this ecosystem that we so desperately need to accelerate the pace of change of, Nashville is almost uniquely suited in a lot of ways to be a hub for that stuff. And so I think the opportunity's there for the area. I think that there's already a significant footprint that can be leveraged, and I think it's now up to the community and the industry itself to see if they can figure out ways of just making it bigger and bigger and bigger. I think the sky's the limit.